Okay,
Go.
good morning, everybody. So today's first section that we're going to be going over is the initial contact log bundle. But first, I'm going to go ahead and just give a quick overview of what we're looking at here on the home screen. Each of these boxes are called widgets. The ones that we're going to be using primarily are the forms and data widget here, my clients widget here. In the forms section here, you can edit it using this button, and you can search for forms and then add the form. You could right click to add folders and then organize your forms into each folder. In the recent forms, this will gather the forms that you've used for each login. Once you log out, it's going to reset this and it's going to disappear from here. That's why I recommend when you guys get a chance, go ahead and build your forms up here by using the edit. The same goes for recent clients. So your recent clients that you've used for each login will show up here. But once you log out, it's going to reset that and it'll be blank on your next login. Okay, so the initial contact log bundle is a bundle of forms. Each form is an individual form that is connected in this bundle so you can complete a full workflow process. As you can see, I have it listed right here. And we're going to use this when we first come into contact with a client to search for the client and also to get them initially put into the system. Let's see. So you can search for forms. If you don't have this built yet, you can search for forms here by beginning to type out what form or bundle you're looking for. So I just typed in initial, and it's going to pull up all of my search results that have that word in it. So you don't have to know the whole name of the form or bundle you're looking for. You could just type in something that is in that form or bundle. So let's go with initial contact log bundle. I'm going to double click here to bring it up. And it's going to have me search for a client. So let's see. I'm going to go with last name Silver, first name John. The search parameters here require you to enter in 3 pieces of information for you to be able to search. So if you don't have 3 pieces of information in, then this search button here is not going to become activated. It's telling me that no matches were found, so I know that this is a new client that hasn't been put into the system yet. Notice that this new client button is grayed out, but after I completed my search and it didn't find any matches, I click OK, and now it becomes available. That's going to throw me into the initial contact log bundle. The first form of this bundle is called the call intake form. Let's call this a walk-in. The client is walking into the clinic. Caller name, it's the same person. So as a rule of thumb, I'm going to recommend everyone to enter in as much information as you gather. The red fields are required fields. The black ones are not required, but if you have the information, enter it in because it might be pulled for reports or different things later on. And if that information is left blank on these forms, it's not going to populate on those reports later. For the purpose of just moving through this though, I'm going to go ahead and leave that blank. For contact type, I'm selecting self. As you can see in the dropdown, you have multiple selections that you can choose from. But the client walked in himself, so I'm going to put self. The call date is today. He came in today. But let's say it was yesterday. You can click Y for yesterday. Or let's say you may have goofed up and it was 5 days ago. What you can do is you can click on the calendar here and you can go back 5 days and click on that date there. Or a pretty neat little trick is you could put T for today minus 5 and then enter, and the system is going to calculate the date for you. Call time is current. The program type is clinic. MH clinic calls because he's walking into a clinic. Once I'm satisfied with my entries here, I look over to the left-hand margin on this side. And I need to click on submit to submit the information on this form. Let's see. I have a question here in the chat. It's asking, so we would input the date the youth was placed with us. So it really depends. I think that's going to be like a program specific question. If that's the date that the services first started, more than likely that's going to be your admission time and date. But let's say somebody called to refer the youth with you a few days before they were placed with you. In that case, you're going to want to select incoming call, the name of the caller, or the name of the client, which would be the youth, the name of the caller, and then right here you would select whoever referred them to you. I hope that answers your question. Alrighty, I am going to go ahead and click submit. Once I click submit, it's going to take me to the next form within this bundle. And the next form is the initial contact log. Over here in the left column, you can see the different sections of this page of the form. And if you'd like, you can even use that to click and it will jump you to those different sections of that form. Or you can simply scroll. All right. So let's get started on completing our initial contact log. The contact method was inbound because he's coming in. We didn't contact him by calling out. The program type is clinic. The program, so for me, I'm going to select the program that I work at. You're going to want to select whichever program or legal entity of where you work at. As you can see, the drop-down selection is pretty large. So I work at the Phoenix Clinic, so I'm going to select Phoenix Community Counseling. The contact reason is he's looking for services at a clinic. Again, this is not a required field. If you see me skip over some required fields, it's so that we can move this along. As Eric said earlier, this is a condensed version, and we want to make sure we have enough time to go over all the material. Priority. So this is where you're going to identify whether it was an urgent or crisis situation, or if it was a normal, I'm seeking services type of situation. I'm going to select normal here. The next spot here is the contact, the person who's coming in or calling in, are they the beneficiary of services? So I'm going to select yes. You can enter the contact's phone number here. Contact's relationship to beneficiary is self. Beneficiary name, we've already identified that it's self. Beneficiary date of birth, again the caller name, but it's self, so we know that it's the same as the caller is the client or beneficiary. If you have this information at this time, you could put this. A lot of times programs will say come in today for services. So if that's the date that you first offered the appointment, you can simply click today. If they say no, I can't come in today, how about tomorrow? Then you can click tomorrow's date. Here, it's free form, so you can just type in any notes from the call as you wish. Requesting medication and counseling services. And I don't know why I'm using capitals on there, but I am. Here's an important spot too. Make sure that you fill this out. The beneficiary disposition. This tells us what was the results of the call. Let's click, we scheduled an appointment. Okay, I'm seeing a couple questions over here. Can we skip forms if they don't apply? Yes, you can. So again, this is the initial contact log bundle. So it has multiple forms in it. If you don't need to complete a bundle, you can search for these forms, the initial contact log, individually. So that's a way that you can skip forms. Also, if you need to skip a certain form in a bundle, you can simply click on this X right here, and it will take you to the next form in the bundle. Another question here is, can we print the intake contact log? So there is an initial contact log report. It's under construction right now because there were some changes that needed to be made. So sit tight for that, but yes. In reports, you can search for initial contact log report, and that should become available to everyone soon. Okay, so I've entered in all my information on this form. I'm going to click submit here. And because that was the last form in that bundle, it kicks me back out to the home view here. I'm going to search for the client that we just put in search clients right here. When you're searching using names, you're going to want to put last name, comma, no space, and then first name. Here's the client that we just put in. Okay, as you can see, he has a P in front of his MR number. This tells us that this is a temporary medical record number. We haven't fully registered him in yet. We've just filled out the initial contact log for this client. So our next step is to give him a permanent medical record number. As you can see again, I have that here. It's kind of laid out according, the forms that I've edited into this are laid out according to the workflow. But if you don't have that, you can simply search for it here. We're going to assign a permanent MR number for this client here. I'm going to double click. Okay, but before I do that, oops, let's go back. Before I do that, I want to show you guys a quick little shortcut. Notice that this client's name is highlighted in green. You can click once here to unhighlight the client, or click to highlight them. Also notice that the client's information shows up here once they're highlighted. This is going to help you when you want to complete forms for the client. If you have the client highlighted here, when you enter or pull up the form, then it's going to populate that client's information into the form, and the system is going to recognize that you're filling out the form for that client. If you do not have the client highlighted there, I'll show you what happens. It's going to ask you to select a client, and then you have to go in and you have to look for the client with that search. But if I have the client selected there and I go into the form, the system recognizes that I'm working under that client and it populates his information here. So what we're doing here is we're assigning this temporary ID a permanent MR number. So go ahead and click on Assign Permanent MR Number. It's going to ask you, do you want to auto-assign the next ID number? At this point, you want to select Yes. And it automatically assigned the next number in queue right here. Do not continue clicking on this, or it's going to continue cycling through the next number, and it's just a waste of MR numbers. So once you see that the number is put here, click Submit. Also, I recommend don't try to create some unique number. Like if you're like, oh my gosh, it'd be so cool if this client had a bunch of ones as their assigned ID number. It's going to throw off the cycle of numbers. So let's just always assign the next number. And click Submit here. Since we completed that form, it's going to kick us back out to the home view. And now we see that the client's MR number here no longer is a P number. It's a permanent MR number now, 4028. All right, so that is pretty much that completes the first section, the initial contact log bundle, and we added the assign permanent MR number form. If there's any questions, please go ahead and ask right now. When asking questions, you could use the chat, or if you find it difficult to communicate what your question is through text, through chatting on the chat, then you can go ahead and unmute yourself and ask it verbally. Just remember to mute yourself again and don't talk over other people.
Hi, Matthew. I have a question for you. Can you hear me? Okay.
Yes.
In my clinic, the intake comes to me after everything is done. So do I still have to go through the steps of this, or can I just create a permanent MR number straight from?
Yeah, so because different programs operate differently, you might not have to do everything that we're showing you right now. It really depends on the workflow of your role inside of your program. So if someone before you already does the initial contact log bundle, they may also do the assigned permanent MR number. I'm not sure. That's something that you guys in your programs are going to want to speak with your supervisors about to define each person's role and see who is supposed to do what. But if someone does do the intake before you, then yeah, you more than likely wouldn't be doing this first part that I'm showing you right now.
Okay, what I meant is the whole bundle already comes to me and nothing is inputted into the system until it gets to me. So will I have to go through this whole process of starting with the P number, or can I skip that and go straight and assign a permanent MR number? If that makes sense.
It does.
Okay.
So I would recommend to fill out the initial contact log bundle, because you're going to be logging in the initial contact. But again, that's a program specific thing, and if your guys' supervisors see that it's not necessary, you may be able to jump ahead a little bit. But to assign a permanent MR number, a client has to be in the system. So you're still going to have to use one of the forms to get their name in this system to create that P number so that you can then assign the permanent MR number.
Thank you.
You're welcome.
Matt, there's another question in the chat.
Okay.
And they're asking, essentially, a couple of people have asked, if they're entering a client who was initially in Simon, does that change the way we input them in Avatar?
Yes, it does. So if they already have a Simon number, then when you assign permanent MR number, you are going to want to click no on auto assign and type in their Simon number and assign their Simon number as their permanent MR number. Most clients should have been converted over into the system automatically. So if they had a Simon number previously, most clients should be in the system, but you may come across some that did not get converted and put into this myAvatar system. So in that case, while you guys have Simon available, it is recommended that you search in Simon for the client also, because if they have a Simon number, you are going to want to use that as their permanent MR number.
Thank you.
You're welcome. Let me see.
Matt, there's another question. Are we still opening and signing with Avatar? Along
No.
with Avatar?
And the short answer to that is no. So as of July 1st, we want to do all of our openings into myAvatar, and we want to stop opening into Simon. All right. So for those of you that have the training environment up, what I want you to do is to go in and complete the initial contact log bundle for a client, and then assign a permanent MR number.
If time permits, you can enter in a couple.
So this is going to help us through exercises throughout the day as we continue to learn new processes and go through the different sections. Then you can utilize this client that you create right now, or multiple clients that you create right now, depending on how much time you have, to complete the processes moving forward. This blue line that goes all the way across is a page break or a section break in the page. Once I've completed this column here and I see this page break or section break, I need to make sure I come back over here and complete this other side. So here you're going to select what applies. Source of admission, you're going to see a pretty extensive drop down for that. Reporting unit is whatever your legal reporting unit is. There we go. And admitting practitioner. This is going to be the person, the clinician or service provider who is going to be doing the initial assessment. Because we're in the train environment, not all of the service providers at your programs are loaded in. So we're just going to pick a random one.
Matt, this is
Yes.
a quick question. If somebody said, what happens if we put pre-admission?
I'm not sure. I've never selected pre-admission. I always select mental health admission since that's what's applicable to me. Can any other super user or anyone else answer that? Who's logged in?
I know we have a couple of them on. Not sure.
Okay.
No response.
Yeah, I would just recommend to select MH admission, or if you work for a substance use program, then to select SUD admission. All right. So seeking the following services. You see it's not a required field, but if you have this information, go ahead and enter it in.
Matt, the only other, I got one feedback, and that was that they've never used that before either.
Okay.
Based on the question, since you do have access to the training environment as we go through the training today, I would suggest maybe doing that as an example, and then we can walk through that and use your client later, again, time permitting. As like I said, we want to try to make sure you have time to do some practice in the system. But again, that hasn't been our practice to use that, so we can definitely see if we have time to walk through that. Sorry, Matt. Go ahead.
All good. Okay, so moving forward, we're going to select the client's living arrangements. Let's say house or apartment. The disability, they didn't. If they have one, you can mark one here. If they don't, you do not have to mark one there. Here are the compliance indicators. So every incoming client should receive a copy of the beneficiary handbook. So I'm going to select yes here. All of them should be completing the NOPP form or the Notice of Privacy Practices. So I'm going to select yes that this client did. They all should be consenting for outpatient treatment. So I'm going to select yes. And here in the advanced directive spot, if you click yes, you're going to see that this becomes a required field and you have to enter in the information of their advanced directive. I've only encountered a few clients that have said, yes, I have an advance directive and here's a copy of it. I'm going to select no so we can just continue moving forward with that. If you have an external reference number to utilize, if you work at ARMC or if you utilize Case Explorer, you can use these fields, but those really aren't going to be commonly used. So as you can see, that is the last section of the first page of this form. Now we need to go to the second page of the form by clicking on demographics here. And here we have quite a bit of information to enter in. You'll see that if the client prefers to use a different name, it's a searchable field. So we can say that the client prefers to be called Long John Silver. And you will be able to search the client from using that. The client's address. And as you can see, I'm really creative, so I'm going to put West Street. If you notice, when I typed in the zip code, it automatically populated the city and the state. So that's kind of neat that it has that information in the system that way. Okay, so yes, Linda, you're always going to want to fill this out and create your MH Financial episode first. Here you have the preference, the communication preference of the client. Here you have their sexual orientation, client maiden name, mother's maiden name, marital status. So I'm going to select this because marital status, because this is something that shows up on a report later. Primary language. I'm just going to select things kind of randomly. But as you can see, some of these have larger drop downs than others. The religion, education. Let's say they finished high school. Employment status. Volunteer work. And now we're going to go into the second section of this page. If they have aliases, you can enter in up to 9. If a smoking status assessment was completed, you can enter that information here and select the date. At this point, you may not have an FI code. If you do, you can put it in here, but if not, you would leave that blank, and it's not a required field. So this is the third page of the form, but it's showing up blank. So let's go ahead and submit our form after we've double checked and made sure that everything looked good. Click submit. Okay, and because we've completed that form, it kicks us back out to the home page. If you want to double check and make sure that you did it correctly, you can double click on the client here and it's going to open up the chart. And we can see episode number 1 that we just created, MH Financial, and the information that we put on there. In this column here, it has the different forms that have been completed for the client. So as the client goes through services and receives and gets fully registered, you'll see this list grow. To close the chart, you'll click on the X here. So now that we've completed creating the first episode, the MH Financial, we're going to want to create the program or legal entity specific episode. To do that, you're going to want to complete the mental health registration bundle. With my client highlighted, I'm going to search for the mental health registration bundle and double click on it. It takes us to the pre-display. This is the pre-display for the admission outpatient form. So we just completed this form and created the MH Financial program. And that's why it's listed here. What we want to do is we want to add another episode. So we're going to click Add. And much of the client's information is going to pre-populate from what we input on the MH Financial episode, which is a fantastic thing because it might seem repetitive, but since much of the information carries over, it kind of helps you out in filling it out. So again, the admission date and time is today. But this time under program, you're not going to go all the way down and make another financial episode. You're going to search for your legal entity on this list and select that.
Also, as this is the training environment, if you do not see your legal entity, do not panic. I know that not all of them were entered into the training environment.
My legal entity is 00036 San Bernardino County OP. So I'm going to select that one for my client. When you guys do this in the exercise, you can look for yours, but like Eric said, you might not find it in this environment, but it should be uploaded into the live environment. When I select this, it tells me this client already has another active episode. And we're going to tell the system, okay, thank you. I know, I just created it by clicking OK. I see a question in the chat. What do we do for advanced directive for school-based clients? And I think I need you to maybe explain a little bit more so I understand the question. I know most of the time I don't believe minors have an advanced directive. They might though. It's just not something that I see really common because their legal guardian would be making those decisions for them. What do we do if our RU is not in the live environment? Who would we reach out to? So different RUs are attached to different legal entities. So it might not be the exact RU, but your legal entity would be related to your RU. I think we have a list of those that we should be sending out to the contract agencies if it hasn't been sent out already. I would recommend you check with your supervisor and ask if they've received that list yet. And if not, then you guys would want to request it. So type of admission, I'm going to select MH admission. I almost replied right now by saying submit a ticket. If you do submit a ticket, then you will receive it. What would you say, Eric, is the best way for them to request that list if they haven't received it yet? So if the agency name and entity number is incorrect, you would want to submit a ticket for that, an IT ticket. So we have a lot of these fields already filled out from the previous episode. Received a copy of beneficiary handbook. I'm just going to speed through these because we just did this for the other episode, and all of the information should be the same. We're going to click on demographics and just take a quick look, make sure all of the information transferred over accurately before we submit it. Looks good. So we click submit here. So what we just did was we created our second episode that is specific to our legal entity. So at this point, you now have two episodes. Your first one, your MH Financial, and your second one, your legal entity. Now it took us to the second form of the bundle, which is the CSI admission. And here you're going to want to fill out all the information. Thank you, Eric.
No problem.
Select the place of birth, the county as the place of birth. Once you select that, it's going to populate what state. Something that you will also see is not California County. So you can select that there if that applies. Coming down right here, on some of our intake paperwork, it might ask these questions here where you can answer these. Here's a required field because it's important that we know if the client is on conservatorship upon intake. This client is not, so I'm going to pick not applicable. The client prefers English. Here it asks how many dependent adults the client takes care of. I'm going to put 0. But this client has 5 children under the age of 18 that he cares for. Under race, you can select up to 5. I'm going to select a couple just so that you can see that you have that option to multi-select. Okay, and that is this form, the CSI admission form, the second form of this bundle. So I'm going to click submit. And it takes us to the third form of the bundle. This is the program assignment form. So remember how I started explaining how episodes are different from Simon and myAvatar? The program assignment here is the equivalent of an episode in Simon. So using the program assignment form, you would open the client up in programs and also close them in programs. The program start date is today. I'm going to assign them to the program that I work at. Let's see, there it is. Here you can select where they were referred from. I'm going to select self. The reason for evaluation or treatment here. The clinician. So Agnes Adams is going to remain the clinician for this client. The physician, you can just select whatever here, but it would be the physician. If you know at this time what physician, if a physician is going to be handling the client's case, you can select them here. If not, and you find out later that a physician is going to be, then you would need to go into the program assignment and update this information. Under services desired, you cannot multi-select here. And I know a lot of our clients are requesting multiple types of services. So what you want to do as a workaround there is click Other and then list the different services here. So I continued typing that they were looking for meds and counseling. So I'll put that there. Who referred you? The client referred themselves. Are they seeking services for probation because of a lawsuit? Is the client currently in a mental health or alcohol drug treatment? If you click yes, you're going to want to type where they're currently enrolled at right here. Here is where you're going to explain what they said, the services they were seeking out. And something that I commonly see on the initial paperwork is, I need help getting back on my medication. And describe alcohol and drug use. This person said, yes, all the time. So if we continue to scroll down, we can see the program closure information here. So that's located on the same form as the program assignment. So if you want to close it, you do that on this same form. We're not going to do that right now. That comes later. So let's submit this form. And it takes us to the next form, the emergency contact. And this person's emergency contact is going to be his mom. And let's say, yes, he lives with mom right now. If you get the address, you can put that here. The relationship to the client is mother. Emergency contact phone number. Whoops. Okay. So this information that you enter on this form is going to populate on the MHS 140 or the face sheet. So if you want this information to show up there, then you're going to want to enter it in right here. Let's click submit. And we know that because it kicked us back out here, that we've completed that bundle and all the forms within that bundle. I'm going to go ahead and double check. I'm going to open up the chart and make sure that we have both episodes and a program assignment for our client. And here we can see both episodes. Let's check program assignment. And here we see the program assignment. Fantastic. And his little quotes that I put that he said right there. Okay, so let's close out the chart now. I see a question down here in the chat. Where did you go to check? So to check, we can open the chart by double clicking on the client's name here. And it gives us an overview of the chart. So the 2 episodes that we just created are right here. And you can click on program assignment over here. And look at the program assignment specifics that we entered in. Another way to check is by opening the admission outpatient form. So notice I have the client highlighted here. If I open the admission outpatient form, it's going to take us to the pre-display that lists the different episodes that the client is open in. You can also use this to edit it. If you feel you entered something incorrectly into the system, you can double check and edit. You can add another one if need be. Alrighty, that completes this section, which is the mental health registration bundle. So if you guys have any questions, please put them in the chat, or you can unmute yourself and ask, and then mute yourself back. We're going to take a few moments to give you guys some time to complete what we just went over for the clients that you created. Okay, so I see a question here. Is there a bundle for the 4 forms you used? Admission, program, MH financial episode? So the bundle is the MH registration bundle. This one right here. You can utilize that bundle to create an episode, to do the program assignment. This form right here, the admission outpatient form, is located inside of this bundle, the MH registration bundle. And that's the actual form that creates the episode. The MH registration bundle includes that form, but also a couple extra forms, such as the program assignment and the emergency contact forms. Yes, they're in the order that I just entered them. So I used the MH registration bundle. So how it was just presented to you is the order that they're in. You're welcome.
We'll give you about 10 minutes to walk a client through the bundle. And then, of course, as Matt said, if you have any questions, you can either unmute or put them in the chat. Thank you.
I see a question here. How do you make the form widget bigger? So you can manage your widgets by clicking and dragging on the borders of them. You can also get rid of widgets. You can also pop them out, undock it, and now this one you can swing around all over the place. You can maximize it. You can close it completely. If you accidentally messed with the widget and you're like, oh no, I lost it. Where did it go? I need that back. You can go to Preferences, click Widget, the Widgets tab over here. And reload home view. Are you sure you want to discard current changes and reload layout from server? Click yes, and then apply. And now everything's back to normal.
And then also note that your home screen, depending on your role and also in the live environment, may look different from this as well. And you also may have multiple roles. So Matt, if you clicked on your home billing,
So here's where you see your different views, that the different roles that are assigned to you. So home view billing shows different data, and your widgets are going to be more specific towards billing. And you can toggle between them. Yes, Christopher, and more than likely it's going to need your supervisor's approval. See another question. How did you create your folders in the form widget? So to do that, to create these and to organize them and move them around and put them in order, I went to Edit and I searched for the form here. And then I clicked Add Form to create the folders, and to name the folders, I right-clicked, Add Folder, or Rename. So you can right-click here and rename. You can also click and drag to move a form to a different folder or to a different spot in that folder. And then you click Save. And then you'll want to click Refresh. And after you click Refresh, it'll add whatever you did to this spot right here. Who would I ask for the episode program list if my supervisor does not have them? You can submit an IT ticket for that, and we should be able to get that to you. First, check and make sure that you don't have it in the live environment. If it's not there, then then you can submit the ticket saying, I cannot locate my program. Can you please send me a list of the legal entities? And and then we can get that for you, and hopefully you'll see it there and you'll know which one to select at that point.
And I'll put the email in the chat again for your convenience.
So already I can tell that for this client right here, we have a permanent MR number assigned, so that's awesome. Let's double click on the client. And remember, there are a couple different ways to check the episodes that are open for the client. One of them is by double clicking on the client here to open the chart. And we can see that we have the MH Financial as episode number 1 and 00036 San Bernardino County Outpatient as episode number 2. So that looks awesome. Let's see what program it was assigned to. Eggleston VHS. Awesome. Looks good. Looks good, looks good. And we even have a little note here on what they said they needed help with, what type of services. So that looks good. Good job. All right, we have another one. Green apple. Notice I'm searching by last name first, comma, no space, and then first name. Okay, maybe green is the last name. Apple green. There it is. All right, let's double click on that client to open it up. Take a look at the chart. And here we have episode number 1 being our 00036. So for this one, you want to make sure that you're first creating the MH Financial episode. And then you're going to create the legal entity episode. So you should have 2 episodes here. Let's see what the program assignment is. Awesome. I see that you assigned them to West End Family Counseling Services. Looks good. You'll just want to make sure that you're creating the MH Financial episode also. Good job, guys. It's cool to see the clients that you guys are creating.
And I'm going to pick up where Matt left off on the client Green Apple and show you guys how to register the mental health financial, and also show you how to put in the guarantors. And guarantors are just Avatar's way of saying insurance. So you'll make sure that your client is highlighted, and you can go into the financial eligibility. Okay, and you see the only one that's in here is the outpatient. So we actually want to register. for the mental health financial. So go into the outpatient admission. And you can click add. Uh-oh. Okay, I can't use that one because somebody's using that one. So let me pick a different client. I have one. Okay. And Avatar only lets one person use a client at a time. So if somebody's trying, you have to wait till they get off or just keep trying. Okay, so you're going to go ahead and you're going to add. And I'm sorry, I don't know what happened. Things out of my way so it's easier for me to see. We're going to go back to the outpatient admission. Okay, and we're going to add. Okay. If somebody's trying to use the clients at the same time, you have to use a different client. You can't use the same client that we're trying to use. Okay, does anybody have a client number that they registered the outpatient on? Let me see if I can find a different client.
I don't think right before break we had one that was green apple.
Yeah, I tried that one, and it looks like somebody
They're
might
still
still
in
be
there?
in there.
Gotcha.
Yeah, it won't let me do any admission for some reason this morning. Try again. Yeah. Try this one again. This one has one. Sorry, I don't have, it looks like I don't have a client. Let me, since you guys have already seen how that works, the registration, let me go ahead and move on and see if we can come back to that after. So let me use the client that Matt used earlier just to show you what goes into the financial. And this one you can see we'll already have the mental health financial. So what we're going to do is we're just going to go in and we're going to edit it. And we're going to add the guarantors. Okay, so he already did this part. So you're going to take that one and you're going to do the financial eligibility. And make sure that you hit the financial and click OK. And then you're going to go to the guarantor selection. Okay, so anytime you add anything, you'll have to click the add and then type in your guarantor. For now, we'll use Medi-Cal because that's most of our clients. Okay, and then you're not going to customize. You're going to input the policy number. So it's going to be the SIN number, and it will be the same number for subscriber and policy number. Okay, and this one's been giving me fits the last couple of days. So, but it's always the same policy. Billing number and subscriber number are always going to be the SIN number, and it's the same number for both. You're going to mark that no, you didn't verify it, because we're going to do the 270 in order to verify that. You'll use today's date because it was registered today, or whatever day it happened to be registered or admitted in. And then the subscriber benefits, coordination of benefits, and release of info is always going to be yes, and that's for billing. And then for us here, we always put in the county guarantor. So you have to put at least 2 guarantors in on every client. So then you'll put the county.
Karen,
Yes.
I got 2 things.
sorry.
One, for me, ask if you can zoom in and show them how you can zoom in on forms.
Oh, yeah.
And then also, we got a request if you can go back to the guarantor and maybe slow down a little bit.
Sure.
Thank
Yeah,
you.
this page is nice. You can actually make this one bigger or smaller. Okay. And for this section, you always go into the guarantor selection to add guarantors. And if for some reason, as you're going through, you find out that you put in a wrong one, before you submit, you can always double click and delete it and say yes, and then just add the correct one. And is there somewhere we can put all the number in Avatar? And this one, are you talking about the SIN number? Because it's just, for some reason, the training environment just isn't accepting a lot of the policies numbers. Plus, I'm trying to make one up. But once it's a real SIN number, it does accept it. So we'll put the county back in. Is that big enough for everybody? And we'll put the county. And see, it lets you know. This one I forgot to go ahead and put add. And I always do that too. So you want to make sure you don't add too many lines. Okay, so just put the county guarantor in. And it's county mental health. And the guarantor plan is county. You're not going to customize the guarantors. And this one you can put yes that you did verify it, because this one is an automatic verification. Okay, and your policy numbers will be here if you have any. County doesn't have any. So for the coverage effective date, Matt registered this one today, so we can use today's date. For coverage effective dates, you'll just go ahead and make sure that it's whatever day they are going to be registered for whatever program you're putting them in. Okay, and the subscriber benefits is going to be yes. Coordination of benefits is always yes. And the subscriber release of information is also yes. Okay. Then you scroll back up, just make sure you didn't miss anything. And Avatar always asks you to put them in order for billing. Okay, so whatever you bill first, this one you automatically bill Medi-Cal first, and then the county is going to be the last of all your guarantors, because that's going to be wherever, whatever money is left over, it's always going to fall into the county bucket. Okay, and then we can hit submit. And I did something wrong. You'll always get, if you do something or you missed something, it's going to give you a message. And I think what happened was I got an extra line in here. When I was deleting and adding lines, I added just one too many. And so you can go in and delete it. And now everything should be okay. Make sure your guarantors are still in order. And that takes them out of order because this is telling me that it was guarantor 3, which I don't have. So now we should be good to go. And when we hit submit, it's okay. So now we have to go in and make sure that for billing, we do a linking. So you're going to go back into your financial eligibility. And you're going to make sure that you take your overarching episode. Now for ours, this is the outpatient overarching episode. Some of you might have your own overarching episode. So you make sure that you want to take your overarching and link it to the financial. It has to be linked to the financial in order for billing to go through. And so you'll double click on this. And it's going to bring up your linking. And so you're going to push yes. And it's going to give you a message that says that if you link to another episode, it's going to erase your current coverage information. That's okay as long as you link it the correct way. So my suggestion is whenever you link, make sure it says financial. If you were to link it backwards and you linked the financial to the overarching, it wipes out all your guarantors. And you don't want to do that because you're gonna have to go back in and put all your guarantors in. So I always know if I'm linking, if it says financial, we're good. If it says anything else, stop and go back out and double check. Okay, so now we can hit submit. And those are all of your guarantors in your financial episodes. Okay, and that one was fairly easy. Let me show you one that's going to be a little bit harder. It's this one. If you have insurance, okay, the KDA, you would just put that form of Medi-Cal in instead of just regular Medi-Cal. I don't actually do KDA, but you would just go back into your financial. And go into your financial eligibility and your guarantors. And instead of putting the regular county Medi-Cal, you would just put in the KDA. And I don't know if I can, yeah, see, you would just pick this guarantor instead. And the specific order is just whichever needs to be billed first. And I'll show you how to do insurance next on a different client because then it's going to get a little bit more complicated. So let me close out of this one and then see here's your KDA provider right there. Okay, so I have a client. Now this one, I already registered the financial eligibility. And this one, we're going to go in and we're going to update this one. So this one has guarantors, and this one had a Blue Cross insurance. So we're going to double click on it. And this is an old client that's coming in for services, returning for services. So what happened was he had Blue Cross insurance and the insurance terminated. So now he's got the Medi-Cal number, that's your policy numbers. If you have the SIN number, it goes under policy number and subscriber number. And if you have insurance, it would be your insurance policy numbers. Okay, and I noticed on your guides, you guys don't have the full financial guides. Okay, the mental health, let me go back out, because it's actually not Medi-Cal guarantor. It's going to be, you're going to have your client highlighted, and you're going to go under financial eligibility for your guarantors. And then it's the mental health financial. And your guarantors are here, unless I'm misunderstanding. So what we're going to do is if we have an insurance, and it's terminated, and then now he gets it back, and this will happen a lot with Medi-Cal also, Medi-Cal clients. We're going to add this one. We're going to add a Medi-Cal guarantor also. So this one you're going to do multiple things with. This one has Medi-Cal. You're not going to customize it, but here's where your SIN numbers go again. Okay, and you're not going to put no that you didn't verify it. Let's see, it's 9 characters. Let's try again. And you can also hit F5 in your box here, and it should wipe everything out. Of course, it's not working for me now, but we'll do. See if that will. Okay. Okay, I'm sorry, I still can't get them to stay in there. Okay, when you're doing your guarantors, are you remembering to click Add? Okay, I'll get out of this one and start over. Okay, we're going to go into financial eligibility. And we're going to click my mental health financial. And we're going to go into our guarantor selection. And we're going to try to add Medi-Cal. And you're going to not going to customize. We're going to put a billing policy in there. And let me see if I can try that one. Okay. Yeah, it's not taking the policy numbers, and I know that's the SIN numbers. I know that's a good one because that's actually a real SIN number. So we'll have to bypass that. But for Medi-Cal, billing policy number and subscriber index number are always the same. You're going to put no because you didn't verify it yet. And for this one, we're going to say, if you say this one, the Medi-Cal started this month. So we're going to give them a registration date for this coverage date of 8/1, because we're going to say he had ongoing services. So you can always backdate it if you need to. And then subscriber benefits, yes. Okay. And then I want to show you this because we are going to have to update the Blue Cross. So this is one of the clients we're going to say has Blue Cross and Medi-Cal. So what happened was this one, he had Blue Cross and it terminated. So we're going to have to reissue it. So you're going to have to double click on it and make sure that it's populated with your current information. And this one, you're going to have to say, yes, you want to customize it. If you went in and whoever terminated it, if they deleted it, that information is gone forever. So we don't want to delete anyone in case someone comes in like this one where the insurance had to start over. It was reissued again this month. So what you're going to want to do is you're going to want to hit yes, you customize it. Yes, it's going to be eligibility verified, and you're going to come down here and you're going to want to create new levels of master work benefit plan. And this is going to say yes. And then you're going to hit this button here for default plans. And it's going to give you a grid. And you're going to say this is when the first time they come in and their insurance started. So that was 5/11/2020. And it terminated 5/31/2020. Then it's been reissued again 8/1/2020. Okay, so we're going to hit enter, and this keeps your insurance so that it keeps a record of when your insurance is terminated, since a lot of our clients are going to use this with Medi-Cal also. Since the clients are going to come off and on of Medi-Cal, you're going to want to keep a record of all of that. And so then you're going to hit save. And it's going to take you out of the grid, yes. And it's going to take you back to your main screen. And what you're going to want to do is you're going to want to take this date here out and reactivate it. So we're going to reactivate it 8/1/2020. And we're going to take this date out because it's still active. Okay. And then I want to take you down to the customization plan. And this is where it's going to show this is your insurance. This was when it was first activated. It terminated for a couple months, and then now it's been reactivated. Okay, so now you're going to go back to where you, this is where you're going to do the order of billing. Okay, so your Medi-Cal, Medicare, insurance, whatever has to go first. This one, the Blue Cross Blue Shield, is always going to be billed first, then you're going to bill Medi-Cal, and then you're going to bill the county. So however it has to be billed first, that's the order you're going to want to make sure to put it in. Okay, so if it had Medicare, you would make sure that the Medicare is on top. If it's just Medi-Cal and the county, then the Medi-Cal will go on top and then the county. And then you can hit submit. Okay, and I don't think there's anything in the registration that will note whether it's KDA. I think it's just the guarantor that's going to tell you that it's a KDA. And I know that was a lot to throw to for the insurance, but is there any questions about the insurance and customization? Because the customization you'll use a lot with Medi-Cal, and you're going to want to keep a record. You're going to want to keep that grid active for any Medi-Cal clients that come off and on of their Medi-Cal. So you'll just want to make sure that you have a copy of that. And that's this customization here. And I can also show you, I didn't show you how to verify the Medi-Cal. I can only take you so far on the 270. Actually, you guys need a new guide on this because it's not in your guide. So we'll have to make sure that you get a copy of the guide that shows the customization. And yeah, in live, it does populate automatically with the non-contract county. If you're, I think it will always stay. You know what, I don't know if you're contracted. I don't know if you have to hit contracted commercial or contracted county. We'd have to verify that for sure. And then for the to verify the county Medi-Cal, you'll go into the 270. And you can put whatever client you need in there. And the episode number will be the financial. The guarantor will be Medi-Cal. Make sure that you do the Medi-Cal. And it will be generic. And then you can populate it with today's date. And this one won't process because we're in train, but you'll hit process. And it will give you a report, and it will say whether it's active or not. And then just make sure that once it comes back with the report and it's active, your post inquiry, you'll be able to highlight it. Don't worry about this. All of the client ID and everything wipes out, but you'll just want to hit post anyways. And then what will happen is once it's posted, you'll have to get out and go back into the financial eligibility, and your SIN number and your aid codes will all be populated. And let's see. The financial eligibility, you have to register them for that. And that's the one. Let me see if I can get one of those other clients to work again. Okay, and that's where you go into the admission and you'll register you'll register them. Under this, see this one only has the one outpatient. So you go in and you'll add the financial admission. So you can use today's date, the current time, and you can, if you have to. I know some of you don't get the admission paperwork at the same time. You can always backdate it if you need to. And the program for mental health is all the way down at the bottom, down here. And this is just saying that you already have one open, and you're going to want to make sure that you do another one, so you can say yes. The type of admission is the mental health admission. And you can put whatever practitioner you need. Okay, and I'll just pick one for now. Okay. And then most of this, the demographics and everything should have already been input. You don't need to do that, but you will have to do the compliance indicators. And for this, we just say no, unless you have all that. Financial episode, and then you would just do submit. And now this is where all of your financial, you can do the financial eligibility now. And it'll go in there. You can just put OK. And now you're ready to put your guarantors in. And for the 270, I don't know if you can print that. And if you have any questions about the customization, just let me know, because I know that's new and it's not in your guide, but we do know about it. So there, you should get an updated guide for that. And I'm always here if you have any questions when you get one. Or you can always put in a trouble ticket and somebody can walk you through it also.
Whoever laughed, don't laugh. Unless it wasn't for us.
I gotta laugh sometimes. Gotta get rid of that tension. And if it was a good joke, you could let us all in on it.
Any questions? Like I said, now would be the perfect time to ask. Do you need anything reviewed? Do you have questions about anything?
Trust me. Even if you have questions later, I'm good. Green apple, sure. And I know everybody's widgets are different too. Let me get back. That's my chart view. So green apple. Okay. Just registered. Financial eligibility. Okay. Okay, so this one doesn't have any guarantors. So we can add some guarantors real quick. So the customization, you really only want to customize if a client comes back with the same type of insurance. Like our Medi-Cal clients, you know how they always get off and on Medi-Cal. So some of our clients will have Medi-Cal for 2 or 3 months, and then all of a sudden they didn't fill out their paperwork, so they lost their Medi-Cal for a month or two, and then all of a sudden they get it back. So that's when you're going to want to use your customization. You're going to want to make sure that you keep those effective dates so that we don't, so for billing, we don't miss any of that information. So the first time that you register a client and you say, you're going to always say no to customizing. You're only going to want to customize when they come back. And once you put yes, that it's been customized, it'll stay in there. The yes will stay in there, but you don't want to customize them at first in case they never lose it. So we're going to do a guarantor. We're going to do Medi-Cal. Let's see, I forgot to add. So Medi-Cal. And we're going to put no. And then your SIN numbers, of course, both go there. You're going to hit no, you didn't verify it, because then you're going to do your 270 once you go through all this process. But you have to hit submit and come back in order to do the 270. So this one was registered today. If you don't have the SIN numbers, you would get this. You have to get the SIN numbers. Avatar doesn't give you SIN numbers, so you would have to use either the meds light or the stoplight, whichever one you have access to, or if you have the client. If the client actually brought in their card, you would be able to get it from there. But I know most of the time the clients forget their cards, so it would have to be the med stoplight or the meds light.
Karen, I have a question. Okay. I run Medi-Cal for all of our clients monthly, and we used to put them in Simon, the number down at the bottom where it says the eligibility code and the aid code. So since we used to do it in Simon, are we going to be doing this in Avatar? Well,
yeah, that's when the 270. That's what you run the 270 for. Instead of, Simon had its own little place where you had to go and put it in. The 270 takes the place of that. I know there was a report that was run too once a month, the meds tape. Yes. And I believe Avatar has something similar to that, but I don't know what it looks like. So you would have to see. I haven't been able to see it yet, but there is a form of that. And let me show you, I have a widget, and I don't know if you guys do or not, but when you bring up the chart view, I have a widget that shows whether the Medi-Cal's been verified or not.
Okay.
See where it says last MHEF SIN comparison?
I'm sorry, can you say that again? Because I can't see it.
Yeah, sorry, I can't make it bigger, but it says last MMEF, and it says SIN comparison, CIN comparison. I don't know if you have that widget, but you might be able to ask for it.
Okay.
And it will tell you whether the Medi-Cal's been run already for that particular client.
Okay, great.
It will bring up the SIN number, and it will bring up every time somebody runs the 270, it will show up in that particular widget.
Perfect. Thank you so very much.
No problem. I do know that a lot of people don't have that one, though. So you might have to ask
I'm going to have to request it. Okay.
Yeah. So,
so with that being said, I don't need to run Medi-Cal once a month anymore. I just do the 270. Is that what you're saying?
The 270 is where you run the Medi-Cal.
Okay.
It's the same thing that was, I don't know if you use numbers or letters, but in Simon, I used to do the FEM screens, and that was to verify the Medi-Cal, and you got the SIN number back on that one. It's the same thing. the same thing. And I do believe you will still have to run it once a month.
Yes, we do. We run it once a month. Yeah.
Yeah.
Okay.
Yeah, I think you'll still have to do that in Avatar once a month.
Okay. Thank you so much.
Oh, you're welcome. Okay. So I think we have see, I think I put the guarantors in. Green apple. Okay. So we'll put no, yes, and today's date. Effective date. And just a quick little quick reference. This is a box for insurance, and you're going to need to put, if you put insurance, you're going to have to put whoever the insurance subscriber is. If you do self first, it will automatically populate the client's info, and then you can always go back, and if it was spouse, you can change just the information that you needed to for that spouse. But for Medi-Cal, it will always be self, and don't forget your benefits and the guarantor section. Make sure that you put them in order of billing. And then make sure too that if you are running the 270, make sure that you're running it in the mental health financial and not your overarching episode. So I think 2747. Okay, so episode number is the mental health. Guarantor, see, you know what? I forgot to put in Debbie. I forgot to put the. I even forgot what client I'm in. I'm sorry. I got lost here. Okay, so green apple. Okay, so we want to run the 270. Okay. And then here's your episode number and your guarantor. Uh-oh. I don't know how I got the wrong guarantor. Let me see. The guarantor is not showing up, so I did something wrong. That's the thing about Avatar. If you do something wrong, it's going to tell you that you do something wrong. So let's do submit. Maybe I didn't submit it. Okay, I'm sorry, it doesn't like me all of a sudden. Okay, I'm not sure what's going on here, but let me show you the linking again too, because I think you had a question about the linking. So if you go in, you highlight your client, and you go in under the financial eligibility. Okay. I'm sorry, nothing's working. Okay, I'm sorry. Is there any other question? I can't seem to get Avatar to go into anything, but I can try to answer a question.
Okay, I'll start asking questions. Okay.
Yeah, I'm not sure why it just stepped on me, so I'm not sure what's going on, but I can try to answer questions.
That's okay. Okay, I remember that you saying that because a lot of our clients, like for 1 month, they won't have Medi-Cal for one, then the next month they'll have it. So that's when you use that ledger, just when we go and run the 270 to let them know that for 1 month it wasn't
Yeah, that would
eligible.
be only if the Medi-Cal terminated and you want to reactivate it. Let me try signing back on again.
But it's just not for a 1 month or 2 month thing.
Well, it could be a 1 month thing.
Okay.
Because you know how our clients are. 1 month they'll have it, next month they won't have it, and then all of a sudden they'll get it back and it will be retro. So that's just an easy way of keeping track of it all in one place, because if for some reason you were to delete the guarantor, all that info gets wiped out.
Okay.
And you want to make sure that for billing, it stays active somewhere so you can see
Right.
when they come
Exactly.
off and on.
Okay. Perfect.
So yeah, the first time you won't have to, because you know some of our clients, especially like with insurance, they'll never get that insurance back. So you don't want to customize it until you actually have to, because it's extra work if you don't need it.
Okay.
And if you have one, I can walk you through it when you actually get one if you need to. I don't have any problems with that, because I know it's so new even to us.
Okay, that'll be one. Yeah, one of my clients just did it this month, but I'm trying to get the CM to maybe go to the worker and see if she didn't turn in paperwork, so forth and so on. But yeah, okay.
Yeah, because if they make it retro and you never actually had to terminate it or anything, that would be even greater, because then you wouldn't have to customize.
Yes. Yes.
You don't want to customize unless you have to. Yes, I know. Yeah. So let me see if I can get back into Green Apple.
Okay.
And while we do, Karen, I know Leonore was trying to chime in, but may have had some audio. Leonore, can you test to see if I can hear you now, or if we can hear you?
I know she had another meeting, so she might have had to leave.
No, she had sent me a message saying she tried to talk, but thought she was on mute.
You probably found something I forgot.
But she's not on mute, so I was trying to figure out what it was.
Here's your 270. So I was able to get back into that. Let me go back. So here's Green Apple. Oh, sorry. Sometimes Avatar gets a little touchy and it likes to open my chart view. So let's go. Okay, so you're going to go back to financial eligibility. You're going to double click on the Medi-Cal guarantor and go into the 270. And here's your client. And you're going to want to make sure you hit your financial episode. And your guarantor is the Medi-Cal guarantor. And the request type will be generic. And then you can just type in today's date, whatever date you're verifying, and hit process. And then, of course, it won't give us any information today, but it will bring up a report, and you'll have like a blue hyperlink. And just make sure and you hit that blue hyperlink, and it'll take you to the reports. And the reports will say whether they're active or inactive. It doesn't give a whole lot of information, but it will say active or not active. And then once you exit out, you'll want to make sure that you post that request. And all this information, don't worry about it. It'll look like this. It'll look empty when it comes back, but the post inquiry will be available, and just make sure and hit the post inquiry. And that will verify the Medi-Cal for you, and it'll give you your EBC number. And once you go back into the financial eligibility and double click your Medi-Cal guarantor again, your aid code, your subscriber ID, and your tracking number will all show up, and this will go from no to yes, that it was verified. But it will show your EBC number once you do the posting. If for some reason you forget to post, the EBC number won't show here, but if you get that widget that I was talking about earlier, and it's this widget right here, and it will show up that it was confirmed. Yeah, it's going to be no, because you're going to run the 270 on the Medi-Cal, and that's when you're going to verify it, and that's when it will give you the EBC number, and Avatar will actually change the no that it wasn't confirmed to yes, that it was confirmed, and give you the EBC number. And you want to hit yes that you verified the county, because there's no way for Avatar to change it on its own. You have to change it. And yes, you did verify that that is a correct county guarantor. And linking, I can do linking because I don't think we've linked Green Apple. So if you go back into the financial eligibility, and you make sure to hit the overarching episode, and you can either double click it or you can hit OK, and it will take you to the next screen. And if it's blank, you want to type yes to link it. If it's already linked, it will show yes, and it will show the financial episode. If it's blank, you want to make sure that you do yes. And this will just automatically pop up telling you that if you link, it will wipe out your guarantors. But it's just actually linking the guarantors that you put into the MH Financial to the overarching. And I'll show you what that looks like. I'm going to just get out of here so you can see what it's going to look like if you don't link. If we haven't linked, so we're going to, sorry, I hit the program assignment on accident. Okay, so we're going to go into the financial eligibility. And I want to show you how your guarantors will look if it's not linked. If it's not linked, you go into your overarching. Usually it doesn't show any guarantors. See how okay, it's going to make a liar out of me, sorry. It usually isn't there, so let me double check the financial eligibility on this one. Okay, see how the county is in this one, but it's not in the overarching? Once we link, and we can actually even link from in here. We don't want to link from in here. We want to go back to our overarching. So we want to make sure that we hit our overarching. And you're going to link yes. Okay. And then you're going to submit it. And then now we should be able to see all the guarantors. See how it, once you linked it, it brought all your guarantors over. So usually if you don't link, your guarantors aren't going to show up under your overarching episode until after you link, and that's so that everything can be billed and your financial and your overarching episode are combined, and there won't be any problems billing. And was there any more questions? Did I confuse you with the linking? Okay, now for the mental health financial, always being episode 1, I can't guarantee that. I know that's how people were trained, but I understand there's a question. I don't know so much for contract agencies, but I know for the DBH clinics, if sometimes they're doing both financial and overarching episodes. If they're not, then the financial interviewers are putting in the mental health financial. So sometimes it will be reversed. Since you're probably going to input both episodes at the same time, I would say yes, that the mental health financial should probably always be episode 1.
Thank you. Any other questions, comments for mental health, financial eligibility? I know it's a lot to take in, and I know also we've reviewed a lot, but I also want to make sure you guys get a break. But I do want you to
you guys got new info today too.
Yes. So perhaps maybe we'll take a 15-minute break for now and give you time to also think of any questions or if anything comes up during the break. And then after the break, we can check back in before we move on to the next section.
Yeah, I can stay on. Not a problem. And then, like I said, I'm here if you have questions too. Sometimes if you think of one later, just email me. And then I'm not sure when the guide will come out. I'll get with Lenore and find out. And I will also, if you have trouble tickets or questions, you can also do a trouble ticket.
Yes. And when I send it out, it will be the most updated. Okay, so let's take a 15-minute break for now and then reconvene at 11:05. Thank you, Karen.
Oh, you're welcome. Eligibility verified. I was telling you that for Medi-Cal, you were going to hit no. That's wrong. You are actually going to say, yes, you did verify. If you don't, it won't bill. So for Medi-Cal and county guarantors, you're going to hit yes, the eligibility was verified.
Thank you.
Before you even verify it. And that will be in the new guide too.
Okay.
Any other questions related to financial eligibility? take the chat has no questions that we can move on. Thank you so much, Karen. I appreciate it. All right, we're good. Thank you.
Okay, everybody. So the next section is the Mental Health Admission Bundle, or MH Admission Bundle. Again, remember that a bundle is a series of forms to complete a workflow process. So in this admission bundle, we will be inputting the diagnosis for the client. That's probably the main form of this bundle. So I have my client here, John Silver, highlighted. Let's see. And with him highlighted, I can search for the MH admission bundle right here. Okay, so it takes us initially to the pre-display, which is going to list the different episodes. This is where you select what episode you want to attach the following forms that you're going to fill out. Notice that MH Financial is not listed here because you don't attach services and diagnosis and things of that sort to the MH Financial. You only attach those to your legal entity that the services are being provided under. So since Mr. John Silver only has this 36 episode, and that's the one that we're going to want to add all of the forms to, it's highlighted. So let's click OK. The first form in this bundle is the CSI admission. If you'll probably recall seeing this form during the, the MH registration bundle. It pulled over all of the information from our previous submission of this form during that bundle. And since it's the same day, none of the information would have changed. So we can go ahead and just click submit, or you can even skip past it because you've already submitted it for the day. I'm going to click submit and I'll show you what it does. No changes have been made. If you click OK to continue, this data will be included in the next CSI compile. If you do not intend to include this data in the next CSI compile, please check or click cancel and exit without submitting. Let's go ahead and click cancel and exit. Are you sure you want to close without submitting? Sure, because we just did it. CSI admissions are to be done periodically and at the admission and the closure. So because we already did one today, we can go ahead and bypass this one. If you submit it, it's not going to be a big deal. That's okay too. Go ahead and click submit. It's just going to show that there are 2 submissions on the same day. Alrighty. So the type of diagnosis that we're going to enter, or I apologize, that took us to the next form of the bundle, the diagnosis form. You'll see there are 2 pages to this form right here. The first one, diagnosis, and the second one, MH only additional diagnosis. We're first going to select admission because this is the admission diagnosis. And when we do that, you'll see that the date of diagnosis populates as the date of admission, which is today's date. We can click current here. And whenever you see a box like this, whether you're adding guarantors or you're adding diagnosis, you're going to want to click new row or add new item. So for this particular form, the diagnosis form, we're going to click New Row. When we do that, it jumps you to a diagnosis search, but I'm going to scroll back up a little bit so we can look at this. When we click New Row, it adds this row right here, and it automatically selects it as the primary diagnosis. It jumped us to the diagnosis search so that we can enter in what diagnosis is going to be the primary one. I don't know. Let's go with this. Or is it 311? Anyways, does anyone have a diagnosis that they want me to use for this one? Schizoaffective disorder. Unspecified. Let's go with that one. Okay. When we select one, or here, let me go back a little bit. I don't want to jump forward without explaining things. Okay, so again, in the diagnosis search, you don't have to know the whole name. Let's say you forgot if it's comma so-and-so. You can search something with just the beginning of it, and then look at the drop-down selection list that it gives you, and select the correct diagnosis that you have. Of course, it's always good to know the full description of your diagnosis and your cross-mapping between ICD-9, 10, and DSM-5. But it's good to just have this available with everything right here. Okay. So when you double click on it in that drop-down selection, it populates it here, and it gives you the code cross-mapping over here. It's going to automatically select active as the status. If the diagnosing practitioner gives you a date of onset, then you can enter that here. If we're entering this in as an active admissions diagnosis, we're not going to put a resolved date. But you do have that option later on as the client may progress through treatment. So as diagnosing practitioner, this is a required field. Let's select the practitioner that we used before for the client. Okay. Now let's go to page 2 since we've completed page 1. In this section, you're going to want to select trauma, yes, no, or unknown. If you have any general medical condition summaries, you can enter those here by clicking on the checkboxes. Is substance abuse a factor? Yes, no, or unknown. If you click yes, then you should also be putting something here in this substance abuse dependency diagnosis. So I'm going to click no. Rather than click submit now, I want to go back to the first page of the form and show you guys something else. Okay. At this time, we have the option to submit multiple diagnoses. So we just have to add a new row right here. It's going to take us right down here for diagnosis search. And you're going to fill this out the same way that we did for the first one. Except we can put secondary ranking here. It automatically put the bill order as number 2 for this second diagnosis. And you also have the option, let's say, oops, I accidentally added a second one. Let me delete it. Are you sure you want to delete these rows? Yes, please. And now we just have the 1 again. So now that I showed you guys that little bit, let's go ahead and submit it. This is going to take us to our next form of the bundle. At this time, it's asking me, do I want to return to the pre-display? Which would be, the pre-display, if you guys remember, is the listing of episodes. Do we need to return to that pre-display at this point? No, because we're not going to enter any more diagnosis under any other episodes. So let's say no, so we can continue on to the next form. Which is our SOGI form. So notice that none of this information is required except for the date of the evaluation, because someone may choose not to answer it or anything. And this is something that the clinical staff member or practitioner is going to speak with the client during the assessment to see how they want to answer these questions here. At this time, we could either click submit or X out of it. And move on to the next form, which is prevention and early intervention. So this form is going to be used for very few programs. You can see that all of the fields are required. So if this is if your program is a program that requires PEI, prevention and early intervention, then you're going to want to fill out all of this information. Mine isn't, so I'm going to go ahead and X out of this one to continue on to the next form. And that completes it. So that was the bundle for MH admissions. And that's pretty much it. If we want to go in and make sure that we entered the diagnosis correctly, we can go just to the diagnosis form. You don't have to open up the bundles every single time. If you want to access one individual form, just search out that one form. So I have my client highlighted here, and let's type in diagnosis under search forms. And here it is, it popped up. I'm going to double click on it to open it up. It should take me to the pre-display that lists the different episodes. We attached it to the 36 episodes, so that's the one that we're going to keep highlighted and click select. And here's another pre-display. This one is going to show all of the different diagnosis entries that had been made for the client for that episode. So as you can see, it has the one that I entered in 9 minutes ago on today's date. You can make sure it's highlighted and then click edit. At this time, you could also add a new diagnosis entry. Let's click edit so we can take a quick look at what we did. And see how everything's here just as we left it and put it in. Let's highlight this one. If you click on the number right here and scroll down, then it's going to tell you the specifications of the diagnosis entry that you did. You can add a row. Alrighty, I just wanted to show you guys that you can go back in and check the diagnosis that you just entered. Another thing that you can check your diagnosis on. Let's double click on the client here in recent clients to pull up the chart. before it used to say missing diagnosis over here on the 36 episode, just like it does on the MH Financial right now. But because we input it, now it's there. Now you'll also see diagnosis form over here in the left-hand margin, and we can click on that and look at our entry here. All right, that is the MH admission bundle in its entirety. Does anyone have any questions?
I'm assuming either everyone got it and Matt's just that efficient, or you guys already left for lunch. At least mentally. Any questions? There's one. Oh, you see it, Matt?
Yeah. What do you mean by that? Can you explain the question a little bit more? Okay, so we only have to put it on our legal entity episode because as you saw during the financial eligibility presentation, the episodes get linked. Alrighty, so if there's no more questions right now, why don't we jump into an exercise and complete the MH admission bundle for our clients? Oh, okay. So let's say that you work in a very busy, fast-paced environment. The program or clinic you're at is just really busy, and every time you start something, you're not really able to finish it, which is okay, because you can always go back and finish it, right? So each time that happens, let's say you open a form, but you don't finish it and you jump to another form with another client and all this stuff, the forms that you have opened will show up across here. And it'll grow larger and larger the more forms that you have, and you could toggle between those forms by clicking on them. So this right here says close all open client forms. So this is a way that you can just close them all. If you have too many open forms, the system will at some point, I don't know how many is too many, but it will at some point say you have too many opened up. To proceed, please close, or something along those lines.
Okay, was everyone able to complete the exercise? I'm going to say, because we're so close to lunch, that we don't want to start on discharge and then have to stop in the middle. So if everybody's okay with breaking for lunch now and coming back at 1, anybody opposed, please either state so or put it in the chat. Like I said, we just don't want to start a new section and then have to cut it in the middle or possibly cut it in the middle. 10 minutes is going to be pushing it. All right, so it seems like that's the consensus. Let's break for lunch. Make sure everyone returns at on time, ready to go at 1 o'clock, because we do have a lot of material, or we want to make sure that we cover everything before the training ends this afternoon. I would suggest you can just stay on the line. Again, just make sure you're still muted, but stay on the line because I will keep the WebEx up. You're good.
All right, thank you, sir. So the next section that we're going to be going over is ancillary services. And what that means is that we're going to be going over client charge inputs, which is the billing portion of the myAvatar system. The form that we're going to use for this is called client charge input. I just got an email back from Karen. I'll go over that in a few minutes. So with my client highlighted here, I'm going to look up client charge input. There are some forms that when you highlight your client and you pull up the form, it doesn't pre-populate the client's information into the form. I think this might be one of them, but just out of habit, I usually always highlight whatever client I'm working in as I go into forms. So let me double click on this and we'll see if it pre-populates the client's info. Yeah, see how we have client ID blank right here? So it didn't pre-populate it, and that's okay. So let's go ahead and say that someone provided a service to this client today. So I'm gonna click the T button here for the date of service being today. Client ID. I forgot Mr. John Silver's ID, but we can search by name here. And here we are. As we tab down, we go to episode number. Remember that we're going to enter in services to the legal entity episode, not to the MH Financial. So make sure that you're selecting the correct episode here. Our program, I'm going to select Phoenix Community Counseling. Okay. And our service code. So let's say that they did an assessment. So the service code would be 331. The practitioner, we're going to enter in the practitioner that's assigned. And here's an authorization warning. We can bypass that at this time. I'm not sure if that shows up on the live system. I don't believe so, because that has to do with the practitioner being authorized to provide services. All that information should be uploaded into the live system. So I'm going to say OK here. And let's say this assessment lasted 90 minutes. The duration is in minutes. So you're not going to put 1 if it's 1 hour. You're going to put 60. If there's a co-practitioner, you can list them here, and you can list the amount of time that the co-practitioner helped out. And if there's a second one, you can list them here, and the same here with how much time they helped out for the service there. As I tab away from the duration here, you're going to see the cost of service populate here according to the service code and the duration. So I'm going to push tab. It's going to give me that warning again. I'm going to say okay. And now we see a cost of service of $315 here. Over here, it has some directions. So if this service requires an emergency indicator, submit the service and then go to the Edit Service Information form to add the emergency indicator. So what this is telling us is if this service is an emergency service, we want to enter in the service here, like regular, and then go into another form afterwards and indicate it as an emergency service. So after I submit this service, I'll show you guys what form to do that in. We're going to scroll down. If these evidence-based practices selections apply to the service and to your program, you're going to want to make sure that you select them here. Any additional service information or notes that you want to add to the service, you can put in these spots here. And again, we have some evidence-based practices selections here. So if those apply, then you're going to want to make sure you select them. After I'm satisfied that I've entered all the information in correctly here, then I click Submit in this corner over here. Okay, I'm seeing some questions over here. Modifiers are used with duplicate codes, correct? So I take that to mean like if there's a duplicate service on the same day, then you're going to want to definitely use the modified code. So let's say that this is the second assessment that that was done today for this client. Then you can look up the code for that, whether it be 77 or 76. So let's put 77. So it would be 33177. You'll know if it's a good code or not because the results will pop up down here. If you don't get any results, then it's not a code, it's not a valid code. So 33177 is a duplicate assessment code. But this isn't a duplicate service, so I'm going to take that 77 off. Okay. Let me see if I can address any more questions really quickly over here. Where can I get the evidence-based practice list? Well, if we go down to where it's at here, the list is right here. So you can scroll through the list there. Another question / concern is I do not have a cost in the box. So they're not seeing a cost of service populate here. What you're going to want to do is make sure that you have all of the required fields filled out. Did you select an episode number? I've noticed that sometimes that will cause a delay in the processing of the form. So you'll just want to double check and make sure you have all of the fields filled out. What location do we use if the client was seen at the office or by phone? Neither of those options on the live version of myAvatar. Okay, very good question. So for right now, pretty much all of our services, well, all of the services are being done by phone. So for me to put DBH site, during this time right now would be inaccurate. I'm glad that you brought that up. Thank you. So what you're going to want to do for over the phone service is put non-face-to-face. See how when I changed that, it deleted the duration? So now I have to go back to duration and type it in again. And now the cost of service is there again. Okay, let me see. My reporting unit is not included in the drop-down options. Okay, remember that this is the training environment, so it's not going to have all of the programs uploaded into it, unfortunately, but in the live system, it should have everything there. In Simon, we were able to enter multiple services. How can you do that in Avatar? Avatar does not have the multiple service entry that Simon did. So you would need to enter in each service independently using this form. Alrighty. So I am going to click submit here. And it's going to ask, submitting has completed. Do you wish to return to form? So if you do have multiple services, which I'm sure anybody who enters in billing knows, you always have multiple services to enter. So then you would click yes here, and it would keep you in the form, and you would just fill out that information to go on to the next one. Let's address the emergency indicator. So let's say that this assessment was a crisis assessment. In that case, I probably should have used like a 371, I think. But anyways, let's say that it's an emergency service. We're going to exit this form. And search edit service information. So the first thing that we do here is we pull up our client. We select the episode number that we're going to search for the service in, and we put it in the 36 episodes, so I selected that. Next, I'm going to come over here to our search parameters. The service date was today, and the service end date was today. So that's the service that I'm going to look for. Then we're going to click on Select Services to Edit to pull up our search results. And here we are. This is the assessment that I just entered in. So we're going to click checkbox there and click OK. And we're going to see all of the information from that service populate into the fields here. If I scroll down a little bit, you're going to see the emergency indicator selection here. And if it's an emergency service, we're going to select yes here. And then click on submit. So let's say that you maybe goofed up and you notice that you goofed up and the claim is still not filed yet. You can also use this edit service information to make changes to that billing entry. Let's say if it was only 75 minutes, then you can change that here and different things like that. Let's say you forgot to switch it to non-face-to-face. You can also change that here. Okay, so I'm going to click submit to make this an emergency service. No, you can't. So the question in the chat is, at the time that you are entering the first service, can you indicate that it's an emergency service? And the answer is no. You have to go into this edit service information to change it. So now it's asking me if I want to return to the edit service information form. I don't need to at this point. I'm done editing services, so I'm going to click no. Now I'm going to go back into client charge input. Because there's one more thing I want to touch on regarding this before moving on. So right here it says, if this service requires a pregnancy indicator, please complete client condition pregnancy link to form on the left, which is right here. So in the live system, they changed it. It's no longer called client condition pregnancy. It's called women's health history. So to make that change in the live system, you're going to want to click on women's health history or go into the women's health history form. Okay, let's see. There's another question here. Are we able to delete notes? Let's check it out. Let's see if we can. Let's see if it'll even let me put something in here. That's not letting me. I don't know why it's not letting me type here. This may be a feature that will be activated during phase 2. I'm not 100% sure. So it's not even letting me put anything into the notes at this time. All right. I'm going to submit this anyways as a duplicate. And there we are. That's how you do the client charge input.
Hi, Matthew. I think, I don't know for sure if when she says delete notes, she meant an actual note, but I was going to ask you the same question, but in our terms of notes, it means like the whole billing. Say, for instance, we messed up the whole billing and put in the wrong Simon number. Is there a way to delete that whole note that you just put in, oh, excuse me, that whole billing that you just did?
Yeah. So right here, it's called the delete service form. So let's pull up our client. Let's say that this one didn't actually take place, that duplicate service. Click OK. And then click delete. And here it's saying, it's giving us the information for the service, saying the following services will be deleted. It's asking one last time, are you sure you want to continue with deleting this? And you select yes. And now it's telling you, okay, it's deleted.
Thank you.
You're welcome. All right, so do you guys enter in indirect services? All right, I'm getting some yeses.
Yes.
Those are going to be like your 435s and your 431s, treatment support, stuff like that. So let's go ahead and go into how we would do that. It's in the same form, the client charge input. Notice that the client ID is not a required field. That's because we use this same form for both direct and indirect services. So let's say it occurred today. The program is whichever one applies. And we're going to do 431. Adult treatment support. We're going to select our practitioner. And let's say she did 2 hours. Notice cost of service is still 0 because it's an indirect service. And then none of this would really apply there. So we click submit. Submitting has completed, and that's it. It's asking me if I want to return to the form. I'm going to click no. So I have a question here in regards to the indirect service. It's asking if we choose an episode number. Now remember, the episode number applies to the client. So because it's an indirect service and we're not applying it to a client, we don't choose an episode number. Okay, let's say you goofed up on your indirect service entry. There's not a form to edit indirect services. So you would need to go in and delete it and then re-enter it. Let's say Agnes only did an hour of adult treatment support. You would use the practitioner only service delete, double click on it. We're going to select our practitioner, Agnes Adams. We entered that indirect service for today, so let's set our search parameters for only today. Let's click on this display practitioner to show those services, and here we are. 120 minutes of 431. Check mark the box, click OK, and then click delete. And it's going to tell us it's deleted. After you're, and that's it. So now that we've deleted it, you would want to go back in to the client charge inputs. And re-enter it with the correct information. Oops. I love how it tells me if I forget something that's required. It even puts a nice little red flag right next to the field that you forgot to complete. go. Submitting has completed. Do you wish to return to form? Okay, I see a couple of questions pop up over here in the chat. I can answer both of them with one answer. An indirect service is not directly related to a client. So you do not attach indirect services to a client. You're welcome. And that's that. If there are any questions, oh, here's a question. Where do you go to correct a service again? So to correct the service, you go to edit service information. And then you would search up the service. Today's service date. Let's start that search. Oops. Forgot something again. And then you select the service that you want to edit, click OK, and then you can change it here. Let's see, what do we put for location if it's for office? So for DBH, we put DBH site. Let's see what we have here. So it's going to really depend on what applies to your program. And as I scroll through, it's kind of looking like DBH site is the most applicable one if it's at the office. For you guys that are entering in services already, what do you use? Oh, looks like we got an update here.
DBH site.
Okay, perfect. Thank you.
You're welcome.
Okay, I'm going to wait just a second to see if any more questions come through. And if you guys want to go ahead and get started on entering in some services for your client, as well as maybe an indirect service or two, we can give you guys a few minutes to do that. And maybe some questions will arise as you guys go through and complete this exercise.
We'll allow about 10 minutes for that. So maybe at 1:55, we'll check back in. See if you guys need more time.
Okay, let's see.
And then, Matt, if you can check your chat.
Yes, sir. Okay, so we have someone who is, Linda is still having some trouble. Looks like myAvatar might be giving you a hard time. Okay, so let's walk through it. If I can have you go to the client charge input screen, Linda. Okay, great. Let's click today for the service and enter in your client ID or search for your client by the name. So I'm going to enter in another service for my client. Okay. Next, go ahead and select the episode number. You're going to want to select your legal entity. Make sure you don't select the MH Financial. Right below that, you're going to select the program. Okay. And below that, we're going to put the service code. I'm going to use 560 this time. Now we're going to go over to the right-hand side at the top, and we're going to enter in the practitioner. And then we're going to go one more field down and enter in the duration. And then we're going to push tab. And when you push tab here, so 560 isn't going to generate a cost. So you're going to want to make sure that whatever service code you're using, if you're looking for it to generate a cost, that it is something that we can recoup some funds for the service. So you might want to select the 331. I'm going to change mine to 371. And then I'm going to go back and enter in the minutes again. This one took 2 hours. 371 is an expensive service. And here we have that. So maybe that might be what it was, Linda, that what service code were you using? Yeah, that's okay. Remember, we just want to bypass that. So click OK right there. And then continue entering in your service information. All right. Okay, David, what client are you entering it in for? Let me see if I can take a look at that. And Linda, did you get a cost of service populate? Hmm. I'm wondering if in this train environment, if there's no programs under that can be built into under this overarching episode of 2120?
That might be it.
So let's test something. Let's see how quickly I can do this. That's awesome to hear, Melissa. Linda, try the same thing. Maybe switch the practitioner. Oh, okay. Try changing the program, not the provider, not the practitioner. Okay, David, I'm gonna mess with your client a little bit, okay? I'm gonna add a new episode. Oh, I can't. So if someone else is currently working in that client in certain forms, it's not gonna let another user go in and make changes. Okay. Okay, I'm gonna give it another shot. I'm gonna add another overarching episode. I don't really know what to select. Let's just try this one. See how it tells me there's already 2 episodes? I'm gonna click OK. Okay. Type of admission, admitting practitioner. Just gonna go with the same one. Make this as easy as possible. Okay, so I just created another episode for PAM test. Now I'm going to try to input a service under the new episode that I just created. Yep, that's it. So in the train environment, it didn't have any programs under that episode. That's what that was, David.
Matt, you're fantastic.
Thank you, sir. All right, so it looks like people are getting the hang of this client charge input. Have you guys tried to edit any services or delete anything yet? Can we have my avatar updated so that every form gets populated if you highlight the name on the first screen? My avatar.
I'm not sure of the question. Every form.
Originally, when you selected on that very first screen, you said if you highlight the client ID, it turns green, right? And then you would go to the forms, and then when you go to the forms, that information would pull over their information, their client ID, and whatever's applicable to that form. But you said in this one form, it doesn't automatically populate.
Correct.
So
And that's almost like a fail-safe. So they don't want information to pre-populate in the client charge input form because they don't want you to accidentally enter in a service for a client just because you may accidentally have it still highlighted here. They want you to go ahead and make the selection in the form for the client that you're wanting to enter the service in.
that's perfect. Thank you.
You're welcome.
Okay.
Alrighty. So the next section that we're going to be going over is the discharge section. This is when we close out a client in the program. It can be due to multiple reasons, whether it's a mutual agreement that the client has reached the goal and is in no longer need of service, or let's say we notice that the client hasn't been coming in for 100 days or so. Then we can go ahead and close them out in the program assignments. There's another closure also, and I'll go over that after we do the program assignment closure. Or we might be able to get two birds with one stone. So I'm going to close out Mr. John Silver here. So I'm going to make sure he's highlighted. And I'm going to use the discharge bundle. So I'm going to search for it here by typing in discharge, and it's called the MH discharge bundle. I'm going to double click on it here. So it brings us to this pre-display that gives us a list of all the program assignments that the client has been enrolled in. So this is the reporting unit for the Phoenix Clinic. So let's say that he's no longer going to be receiving services here. We are going to make sure that this is the one that's highlighted. If there's multiple program assignments here, you want to make sure you click on the correct one. So this program assignment is highlighted, so we're going to go ahead and click Edit here. And remember when we first did the program assignment, I said you can scroll all the way to the bottom here. And you'll see the program closure section right here. Another way to do it, let's say you're at the top and you're like, hey, I need to do a program closure. You can just click right here. Bam, and it takes you right to that section. All right. So we're going to close them as of today. So let's click T for today. Program closure reason. This is where you submit the reason that it's closing. Let's say it's a mutual agreement and the goal was reached. The client is no longer taking medication and no longer receiving treatment. Referred to wouldn't really apply then, but I wonder if you could put self. I think self is a selection here. Self. Prognosis, favorable. And now I'm going to click submit. We filled everything out that we need to. Remember, it's always good to fill out as much information as possible. Even though none of this is required, and it's not going to be required because it's a part of the initial program assignment. But even though this isn't required, fill out as much as possible and click submit. This is going to take us to the next form. Which is the discharge form. Okay, and I'm going to go over that question right now, Linda. So if the client is just not going to receive services again, we are not going to actually close out the episode. We're going to keep the episode open. We're only going to close the program assignments. I don't know if you guys have recognized, but many of our clients will maybe not show for a long period of time, and then a year later, they'll show up and they'll want services again. So we don't want to close everything out. We don't want to close the overarching episodes out. We only want to close the program assignments. So part of this MH discharge bundle is discharging the episode, but we don't want to do that. So we're going to click cancel right here. We already did the program closure on the program assignment form, and now we're going to say cancel to discharging the episode. This should take us to our next form. In the bundle, let me see what just happened. I thought there was one more form in that bundle. Nope, we completed it. See how it accepted the program end date? So another way that you can do that, whoops, wrong thing, cancel. Another way that you can close out just the program assignment is you don't have to use the MH discharge bundle. You would just go into the program assignment form. Okay. And let's pretend that this end date isn't there. You would go to edit. And then you would fill this out and click submit. And that will close out the program assignment. I'm going to go back out. Okay, so the MH discharge bundle. Well, here, let me backtrack just a little bit. Whenever you do an opening or a closing, it's good to do a CSI admission. I'm not sure if that's a requirement in your guys' programs, but it is here, and as a good rule of thumb, it's good to do that. So let's go and do the CSI admission. So when you open something and when you close something, you want to do the CSI admission. Here's our legal entity. So that's where we're going to want to attach the CSI admission to. And let's say it's a year, it's 2 years later now, right? And one of the kiddos is over 18 now, so he only takes care of 4 because they moved on. They wanted to go live with some roommates or something like that. So you're just going to want to go through and make sure all of the information is accurate and current, and then click submit. So when you do a program assignment closure, you're going to go into the program assignment form, enter in the closure date and information, and then you're going to go into the CSI admission form and make sure all of that's updated and submit it. There's another type of closure that we do though, and that's if in the unfortunate event that one of our clients is passes away and is deceased. So let's say that's the case here for Mr. John Silver. First, I'm going to open him back up like if I never closed it, if it lets me. Is it F5? Yeah. Okay, so on these buttons, if you want to take them off, you can click on them and click and hit the F5 key. Should work for these as well with the drop downs. So I just took away all the closure information. I'm going to submit it, reopen it. Okay. So let's say Mr. John Silver passes away and we need to close it out. This is where we would use the MH discharge bundle. And this is where we would actually close the episode as well. So here we're going to first close out the program. Go into edit. I wouldn't even know what to select under prognosis here. If they're passed away, 4. Excellent, good. Maybe nothing. Okay, so let's submit that so we can close the program assignment. And now we're going to close out the legal entity here that we opened, our 36. Click OK. Date of discharge today, current. Let's say Agnes is the one filling out the discharge information. Type of discharge. I wonder if it has something here. No. So we just wouldn't select anything there. But it does have date of death. Accident. And then you have remarks that you could put in right here. Demographics. Just make sure everything's updated. Under CSI, I'm a little stuck here. I'm not sure if we would select expired here. Seems like kind of an insensitive term. I'm going to select it. Oops. And none of these apply to this instance, so we're not going to select anything here. It's not letting me take that off. I accidentally clicked it. Anyways, okay. And then we're going to click submit. And now we can check and see if the episode was discharged. I see a question in the chat. It says, what if we do not have death information? Sometimes you won't get all of the information. But a lot of times you'll get enough information to go ahead and fill all of that out. The only piece that I can think of that you may not get is whether it was an accident or suicide. Sometimes family members that may notify the clinic, they might not divulge that information. But it also depends on where we're getting the information from. So I know it's common practice here at our clinic that we'll have one of the service providers who's either familiar with the case or one of the supervisors reach out to whoever notified us of the client's passing and touch base with them and just kind of have a conversation with them in regards to that. I'm not sure if your guys' programs or clinics have the same type of process, but if so, then more than likely you will get all of that information. If not, you can see that those fields were not required. So if you don't get that information, then it's not required. Okay, let's go into the client's chart so we can see that the episode was discharged. And here we have our 36th episode, San Bernardino County OP. And we have a discharge date right here. So those are the two different types of closures that you're gonna be performing. The only time you close out the episode is in the event that the client is deceased. Okay. So we had a couple other questions that it looks like I may have missed. One is asking, this is used only if a client passes. I hope that was answered. If not, can you please explain a little bit in the chat again? And another one, let's see. Okay, I see. The other one's a comment. Do you guys have any questions?
Look, I did see this question earlier. And I probably need more. It says, can you sort clients by current clinician? Not sure what that question is asking.
So that's something that we're going to go over a little bit later. I touched on it briefly earlier, that question about sorting out clients by clinicians, what clinician they're assigned to. And I had said that I think there's a report for it and that I'll look for it later. I think this is the report. I'm going to minimize it while it loads and we can stay on track a little bit right here. And then hopefully it's loaded by the time we get to that portion of the training. Let's see. So the staff tab is going to be something that is a feature that's disabled right now. What it would be used for is for staff to be able to look at their list of clients. So it's not something that anyone can just use and look up a list of a certain staff's clients. It's more for that specific staff, whoever is logged in, they can see their list of clients that are assigned to them. But that's disabled right now, so that's not something that can be utilized for that. You're welcome. All right, so let's give you guys just a couple minutes to go in and maybe do a program closure and or a complete episode discharge. So I'll let you guys kind of decide what you want to do with your clients. If you've created multiple clients, why don't you do one of each maybe? Let me.
Okay, you're good.
So the next section of the training is client information. We have a couple of things that, that we're going to go over here. The first one is update client data, and that's the name of the form. So I'm going to have my client highlighted here. And over here on search forms, I'm going to type in update client data here. And here we can change anything, any of the demographics. Let's say he moved. Oddly enough, it's the same street number, but now it is East Street. Okay, so we're going to update that and click submit. And that's it. That's it for that form. It's a very simple form. It's where you update the client demographic data. I'm going to go back into the form and just slowly scroll through it so you guys can see the different fields that you can update. It's pretty much all the same fields that we went over when we registered the client. So if any of that needs to be updated, not many of these will change, but some of them will. Phone number seems to be a frequent changer, as well as client address can change often sometimes. Let's say they went back to school and now they have their bachelor's and they are also working, I don't know, full time. Not in the armed forces though. What's the next one? Whatever. Full-time training. Um, You can also enter in the FI code and FI expiration date if that's information that you now have because you didn't have it when you first registered the client. But yeah, very simple form. Click submit and you're good there. If you have any questions, please put them in the chat because I'm going to continue on to the next form, which is client contacts. Okay. So in this form, you can enter in client contact information. Our goal is to use this form to track release of information authorizations. So let's go ahead and fill it out. Contact type. The contact is a non-client. Contact status is active. Relationship to client is, let's go with spouse.
Okay, I'm sorry, Matthew. You said release of information. That's PHI?
Yes.
That's okay, thanks.
You're welcome. But also you can include other types of contacts and just specify that in the comments here.
Okay.
But like, so let's say the client gives us an authorization to speak to their mom for the next year, and they fill out the form and sign it and all that good stuff. Then you could put on here authorization to, let's say, speak to spouse, because I already put spouse up at the top. To spouse. Liz Silver expires a year minus 1 day from now is the regular amount of time that authorizations take to expire, or the default amount of time unless otherwise specified. So you can put that in right there. Under client ID. It's not letting me put that, I think, because it's not a client. Emergency contact. Is this person also an emergency contact? Let's say that the client said yes, that they are. Contact name. I think you still have to do the last name, comma, first name like that. Yes. And it accepted that. So you're going to want to enter in as much information as you have here, that you have here as possible. So I forgot what it was. It was like 1583 East Street, zip code 92415, San Bernardino. Oh, it's self-populated. How cool is that? Home phone 909-256, whatever. Occupation, if you have that. And then we can submit it. At this time, I don't have any more client contacts to enter, so I'm not going to return to the pre-display. And that completes that form, and that's why it kicked me back out to the home view. The other form that we have in client information is the woman's health history. I don't believe that form is uploaded into this train environment. No, it's not. But go ahead and look it up in the live environment and that's where it will have information such as a pregnancy record. Yes, good question, Linda. Yes. So this would replace that because you would put spouse and list them as a client contact. But actually, let me retract that. No, the thing that is going to replace significant other in Simon is the emergency contact form, emergency contact information that was part of the MH registration bundle. These are just going to be extra contacts. Okay, so let me have you guys take a few minutes to maybe enter in a client contact or two, as well as update some client information. And please feel free to put any questions you have in the chat here, or unmute yourself and ask. Okay, thank you.
Matt, you said the emergency contact form was also in the MH admission bundle? Or the registration bundle?
Before I start talking about it.
Done.
Okay. So the next section that we're going to go over is the client ledger, which is a report that shows the services that have been rendered to the client and the billing that has been entered for those services. It's really easy to access. So let's access it for our client, John Silver here. And we just type in clients. So whenever you type in client, you're going to get like a pretty long list of drop downs here. It's at the top right here. If you want it to get more specific, of course, you just type in a little bit more of the form name. So client ledger, we're going to go under client management here. We're going to select our client. Remember that when you're selecting the client by name, it's last name, comma, first name with no spaces. And let's look at all episodes. You can make it specific. We've only added episodes to the 36. But let's say you want to pull up services for every single episode the client may have. If they have other episodes, you can click all episodes. You see the from and to date self-populated here, because those are the only dates that we can possibly search for services since they were just open today. When you look up different reports like this, you're going to have a choice here of what type of ledger you want to look at. The crystal report shows a little bit more information, and it also includes hyperlinks that will take you to more information. The simple report is exactly that. It's a much more simple looking report. So it just depends on what you're looking for. I'll show both of them to you right now, starting with the crystal report. All right. And here we have the service that we entered in. We have the client name. If we click on this hyperlink right here, it's going to give us the client demographics. And when you click on hyperlinks, what it also does is it opens up a new tab right up here. So now you could toggle between the different tabs that you've opened up. So let's look at assessment. And that tells us a little bit of information about that service. Just the service code definition. We can look at graph of charges and payments by month. All right, so that is the Crystal report. I'm going to say yes. It is equivalent to the service maintenance. Yes, you can print it. There's a little print icon up here at the top. Print report. All right. So I'm going to close out the Crystal report now. Whenever you process a report, you get this prompt here. Processing report has completed. Do you wish to return to form? I'm going to select yes because now I want to show you guys the simple report. See how it kept all of my information? That's pretty helpful because I'm just going to change one thing here and we're going to look at the simple report. There's a question in the chat. Can you run a report of services performed by practitioner? And the answer is yes. We're going to be going over that in one of our sections coming up. Okay, so now I'm going to process the simple report. See how it just looks a lot more simple. It doesn't have quite as much information. You don't have the hyperlinks. You can print here. Alrighty. I'm going to dismiss this one now. And that is the client ledger. At the end, again, you're going to see this pop up. Processing report has completed. Do you wish to return to form? I'm going to click no, and it's going to take me back to the home view. So that's what the Crystal, what the client ledger looks like as a Crystal report and as a simple report. Let me have you guys run one of those for the client that you've entered services for. It shouldn't take more than a minute or two. And if you have any questions, please ask. And we'll move on to the next section at 3:30.
You're good.
Thank you, sir. So the next section is client census management reports. And there's 3 reports that we're going to look at here. The first one is details of admissions by program. Detail of admissions by program here. So this is a report. And let us pull up data for the month of August. Let's select the 36 reporting or legal entity and process it by clicking here. So with Crystal Reports, it opens the report into a different window. And here we're going to see all of the different admissions that were done into the 36 San Bernardino County OP program. Pretty good. You have your admissions information, the date and time. You have your client ID here. Over here you have the name of the client. Here you have a little bit of demographic information, social security number and date of birth. You have the admission diagnosis and admission practitioner, as well as the type of admission here. Okay, so that is the detail of admission by program. I'm going to close it out now. Oh, can I zoom in? I'm sorry. I'm glad that I saw that. Here. It's 200 too much? Maybe too much. Let's try 150. There we go. Now you guys can see a little bit better.
So these are considered open episodes for the month?
Right. Well,
Okay.
for whatever to and from date that you select.
Okay, thank you.
You're welcome. So I really like the way reports are run in myAvatar compared to Simon. For Simon, some of the reports run daily or monthly. And if you want them at any other time, you have to send in some sort of ticket requesting it and all this stuff. But in myAvatar, a lot of these reports are on demand. You just need to know the name of the report and you could search it out. All right, so I'm going to close this window now. And of course, it's giving me this message box. Processing report has completed. Do you wish to return to form? I'm going to select no, because we are going to go into our next form, which is detail of discharge. Detail of discharges by program. And the search parameters are pretty much the same thing. It's asking us, when would we like to begin the search from? What date? So we're going to put August 1st. And here we're going to put today's date. Let's select the 36 program again and click process here to pull up the information. Okay. So these are the clients that have been discharged so far in the month of August. I'm going to zoom in a little bit so you guys can get a closer look. It has the date of discharge, the client ID number, the episode number, client name, LOS. Not sure what that stands for. the type of discharge. This one, the client moved. This one, the client is deceased. And this one is an administrative discharge. Over here, you have the discharging practitioner, as well as the discharging diagnosis. All right, I'm going to close this one out. And I'm going to click no here, so it sends me back to the home view. The next report that we're going to look at is the master client inquiry. We have a question here in the chat. If there were more for a category, would they print in that order, or is the discharge by date? Are you asking like if there were some discharges done on August 1st, August 2nd, and August?
There's like a few different kinds of discharges, right? Like there was an administrative discharge. Like let's say there was 5 administrative discharges. Would they be grouped by the type of discharge?
I believe that they are not grouped by the type of discharge, but rather by the date of discharge.
Thank you.
You're welcome. Okay, so the next report is the master client inquiry. This is one that I like a lot because to me, it's like the MHS 140 face sheet, but kind of like maybe beefed up on steroids. So let's take a look at it. Okay, so we have our client pre-selected here. And let's click on the 36th episode and go to process. Okay, so on this first sheet here, you're going to get the client demographics, as well as some admission and discharge information. But what I like about this is it has these hyperlinks down here, so you can look a little bit deeper into the client's history with different programs and episodes. So we can look at diagnosis history. And remember, as you open new hyperlinks, it opens up new tabs at the top up here. So now you could just toggle between the different tabs. So that is the master client inquiry. It's asking me if I wish to return to form. I'm going to select no, and it's going to take me back to the home view. All right, that completes client and census management reports. If you guys have any questions. Oh, okay, we have a question here. After clicking on hyperlink, how do you go back to the report? I'm going to pull up the report again so I can demonstrate that. Okay, so remember, each time you click on a hyperlink, it opens up a tab up here. See the tab that we're currently on is preview. So let's open up some more tabs. And see how each time I clicked back to the main report view by going back to the first tab, the preview tab. So that's how you get back to the main page of the report, by clicking on that preview right there. All right, any more questions? Okay, I'm gonna give you guys a few minutes to go ahead and go in and explore that a little bit. Maybe pull up a couple of reports, master client inquiry, or detail of admission by program, or detail of discharge. Please.
Real quick question.
Yes.
Okay, I usually get a 142 and a 117 report. Do they have that in Avatar? I mean, yes, Avatar.
A 142 and a 117.
Yes.
A
And
142.
then there's another one, I think it's a SC1. It's something where it's every therapist, what they build, and then I compare it to their CDIs. Yes, SBC 100. Thank you.
Or are you thinking of the 902 report?
That too. I mean, because we have a queue, so I'm just trying to see, everything that comes in the queue, how do we get that?
Yeah, so we have only one more section left of the training.
Oh, I'm
and we're
sorry.
going to be
Okay.
going over those reports.
Okay, sorry about that.
No, you're okay. It's good to ask questions.
Okay.
Okay, let's wait just a few more minutes and see if anyone has any questions regarding the reports we just went over. I'm going to stop sharing my screen just for a moment so I can look up, see if I can find a list of reports. Okay, I think I found something that we can use. All right, I'm not seeing any questions come through regarding those reports. So now we're going to move on to the final section of the training, which is crystal reports. We can kind of jump around, and if you guys want to ask questions, I think you said something about the 114 or 117 report. If you want, you can type it into the chat and search for those different reports that you guys might have questions about. Okay. So it's a 117. Staff Activity Analysis, PSP 117. So the great thing about searching for reports is in the development of the name of these reports and everything, we tried to keep the old Simon name a part of the new name in myAvatar. This was supposed to make it easier for you guys to hopefully to find the reports, so that when you're transitioning from the old system to the new system, that you guys don't have a difficult time with all of that. So let's look up the 117. We have start date. Let's start it at the beginning of the month and have it end today. You don't have to specify the reporting unit on this one. Just know that if you don't specify it, it's going to pull up information for multiple reporting units. All right, and here we are. The 117. I'm going to zoom in a little bit before moving on to the next form. Okay, let's look up the 142. That's the next one I'm seeing in the chat here. The MHS 142, Reporting Unit Service Summary. Let's have it begin at the beginning of the month and end today. Oops, today. And process.
Thank you.
You're welcome.
Yes.
Okay, so if we look at the top here, we can see that this has multiple pages. So if you're ever wondering, hey, how come there's only a little bit of information on this page? Look up here and make sure that that your report is multiple pages or not, so that you can kind of scroll through those pages and check out the different reporting units. This particular report has a separate reporting unit on each page. Okay, so I'm going to close this one. It looks like the next report that we have here is the 206A. The staff caseload summary. I'm going to try to grab a little bit more information here. Let's go back to that date and have it end on today's date. It's asking for us to select a program. Process it. Taking a little bit of time here. Okay, this is taking a little bit too long. I'm going to close this out and let's select a more refined search. And maybe this will happen a little bit quicker here. Okay. Oh, I ran one earlier today. That's right. In hopes that it would be loaded by there it is. Okay. So this is one that I ran earlier because I was hoping that it would load by the time we got to this point in the training. I'm glad I did that so that you guys can get a look at this. I'm going to zoom in a little bit.
I don't know if it's only me, but I'm just seeing a gray screen.
I don't see anything either.
Me either.
Uh-oh. Okay, let me see what I can do. I'm going to stop sharing and then start sharing again. Can you guys see the report now?
Yes.
Okay, great. I had to actually select the report rather than view it from my avatar. Probably because I ran it earlier.
Or because it was in a different window or separate.
Oh, yeah. Yep. Okay, so that's the 206A. Now I'm going to go back to is it this one? Nope.
You might have to just choose to share the other screen, which was your avatar.
Okay. we go.
Yep.
Okay, let me see. We have a few more requests here. The 902 is actually going to be called something completely different. So for those of you that do auditing of your billing, you're going to want to maybe pay attention and write down the name of these two reports. So for direct services, it's called Direct Service Detail Input Verification. I'm going to double click on it to open it up. And let's look at services for today at the Phoenix Clinic and process it. So you're going to select your reporting unit here and your date of the services that you're looking at right here. Took quite a long time to show us the one service, but here we are. So this should be grouped by practitioner. So this is the equivalent of the 902 for direct services. I'm going to zoom in a little bit here. Okay, I'm going to close it. I'm going to select no, so I go back to the home view. And now we're going to review the indirect service 902 equivalent. And this one is called indirect service input verification. I'm going to double click on it now. And we're going to select the reporting unit.
Quick question, for the direct service detail input verification, are you able to do that for a time range or just for one day?
Just for one day.
Okay.
Okay, and then we're going to click process to start running the report. All right, that was a great example. Oh, because I deleted the one. Okay. But does anyone remember a reporting unit that they entered indirect services on? And if so, can you put it in the chat and I'll look it up? If not, this is what the report looks like. It's identical to the report in Simon, just like the last one was for the direct services. Okay, not seeing anything come through on the chat. So let's go ahead and keep moving on. We also have a request for the 941. Let's search that up. The monthly client charges report. you have a start date and an end date and the reporting unit. Okay, here it is. The monthly client charges report, MHS 941. I'm gonna zoom in a little bit there. Give you guys a second to take a look at it. Okay. The next one that we have here is the 134. Medi-Cal eligibility roster. So this one is going to be by month and year. So we can type in 08-2020. You're going to select the reporting unit. All of these fields are required in red. And we're going to hit process to pull up the report results. And here we are. I'm going to zoom in just a little bit. I'm going to close this out now. And there's one more report that I want to show you guys. So there's a question, what is this roster for? It shows clients that have Medi-Cal or don't have Medi-Cal, and when it was checked, right here, it's wanting us to check it. So it's telling us that this hasn't been checked for this client. And right here, it would tell us if their Medi-Cal is okay or not. You're welcome. Okay, I'm gonna close that one.
Hi, Matt. Sorry, what was the name of the 941 report?
Monthly client charges report. All right. So there's one more that I want to go over before we open this up for questions. Oh, okay, we got another request. Let's type it in. The 942. Oh, the clinic morning report, of course. That's a good one. So it's probably not going to give us any information because this isn't the live system. But let's give it a shot. Or this isn't the live system, it's the training system. And what this report shows us is if a client is open at your reporting unit, it tells us if they were opened at another reporting unit during the last, I think, what is it, day? I'm not sure. Someone correct me. Because it's a daily report, I think that that's what it shows us. Okay. Awesome. And it does have some information for us. Okay, right. So it's services that were entered at other. Oh, right here it has the opening date. So yeah, there's the 942 clinic supervisor summary morning report. Okay, I'm going to close that out. Let's look at the 140. Let's bring up our client here, Mr. John Silver. So here's your client face sheet, MHS 140. So it looks a little bit different from the ones that used to print out in Simon. Of course, it's not going to look exactly the same, but we were able to add a few more pieces of information on it, such as the FI code and FI expiration date. We have the insurance providers coming across here, the emergency contact information here, and we have two of them. We have Mary Silver right here and Liz Silver right here. If we look further down, we have different programs that the client is opened up in. Notice how it doesn't say episode anymore right here. It says program. Because in myAvatar, they are called programs, not episodes. Here we can see that we opened the client on this date and we closed the client on the same day. They received one service, and that was on this date. I'm going to zoom in just a little bit so you guys can get a closer look. Okay. Alrighty, and that goes over, we just went over crystal reports. Do you guys have any questions?